Hello, last in our hip series, okay, in my crazy playroom. Um, so hip lateral rotation. Now we've got some crazy stuff going on here with our hip lateral rotation. A few things that take your brain a hot minute to wrap your head around, okay? So I want you to think, here's the pelvis, okay, there's my femur. Here's the inside of my pelvic bowl. That's my hip flexors going straight over the front of my hip. That doesn't seem crazy to think that when those shorten, it's going to pull my hip into flexion. Pull my hip into flexion just like that. Okay. But these hip flexors, they also wrap around to the inside and back of that lesser trochanter there on the femur. So think, I just lost them. So my iliacus and my psoas major. So think if they're on the inside of the pelvic bowl, they come down and around to the back of that femur. When they shorten, it is 100% going to pull that femur into lateral or external rotation. Okay, so those to me are kind of weirdos. The sartorius, also that same line of pull, he wraps around, right? So he's also going to be an external rotator. Okay, so that's 3 right there. Now you have a few others. You know that the biceps femoris, if it's lateral rotation at the hip, the lateral hamstring, the long head, right? Because the long head comes all the way up to the ischial tuberosity. He's going to externally rotate. Then we've got to check off the booties. Let's check the booties. Glute max, of course, and then the posterior fibers of glute medius. Because remember, the posterior fibers extend and externally rotate. The anterior ones flex and internally rotate, but we're only interested in external rotation. So those posterior fibers of glute medius. So that's 6. Lucky for you, if you split them in half, 12 total. We have those 6. Your hip flexors, iliac, psoas, biceps femoris, sartorius, glute max, posterior fibers of glute medius. That's half. The other half are called the functional group, the lateral rotators or external rotators, also known as P-GO-GO-Q. Now here we can see P-GOG on all of the models that I've ever worked with, that I've ever been able to find, really. Well, it would help if I could get him on. He's looking kind of crazy, isn't he? He's not wanting to stay. I'll get him. All right, that's good enough. These guys right here, they look almost like fingers. And if you do your fingers like that all together, if you think about it, putting it on your hip. So think about from the glutes, from that pelvis region, and then grabbing the intertrochanteric crest and then pulling on that femur. That should make sense to pull it. If I'm grabbing that femur, pulling into external rotation. And if you do your hand like this, there's 5 fingers, right? If you add 1 on the inside, that's the 6th one. That's the second O. P-GO, go, that G-O, that's the obturator externus. They never ever put him on a model. I don't know why. So piriformis, gemellus superior, obturator internus, gemellus inferior, obturator externus, hi, but I'm never on the model, and then quadratus femoris, P-GO-GO-Q. They're literally fingers. They run right down there. They're really deep, though. They're underneath the booty. So if you pulled the booties off, all 3 booties, they'd be under there, a little bit deeper. Okay, quadratus femoris, he's the last one. And if you run your finger down that intertrochanteric crest, you're going to feel a bump in the midsection of that between the trochanters. That's your quadrate tubercle. That's the site of attachment, the distal attachment site for the quadratus femoris. Now, quadratus femoris is named that because he is attaching to the femur and he is a quadrilateral or a 4-sided polygon shape. Looks like a rectangle. Okay, that's his shape. Quadratus femoris. Now, The obturator muscles, they sandwich the obturator foramen. So the internus is on the internal side of the obturator foramen. The externus is on the external side of the obturator foramen. They're in order. They're little fingers. P, go, go, Q. You got half there. Then put it with your other half. Again, chunking logically. Remember to check on those functional groups. Are the hip flexors involved? In this case, yes, they are. Iliacus and psoas. Are the hamstrings involved? If so, how? Biceps femoris, lateral rotation, lateral hamstring. Are the booties involved? Yes, they are. Glute max, posterior fibers of glute med, and then you have your sartorius, right? You've got to think through in meaningful chunks. You can do this external rotation or lateral rotation. Again, it's rotation. So plane is going to be transverse. Axis is going to be longitudinal, vertical, superior, inferior. Whichever way you want to call it's fine. Just make sure you're familiar with all of those terms for the axis that goes with the transverse plane. External rotation. Whoosh. There you go.